Wisconsin Eye's 2014 election coverage is brought to you by the Wisconsin Hospital Association. For over 90 years, a valued voice for Wisconsin hospitals, supporting high-quality, high-value care in communities like yours.
Wisconsin Eye coverage of the 2014 elections continues. We're interviewing Senator Paul Farrow of Pewaukee. He's a Republican seeking re-election in the 33rd Senate District. Paul, welcome back to Wisconsin Eye.
Thanks for having me, Steve.
Programming note, Wisconsin Eye appreciates the support of the Wisconsin Hospital Association, which represents more than 139 hospitals and health systems, for making these candidate interviews possible. Paul, on Sunday, the governor said, let's cut income taxes again. 4 days earlier, the Fiscal Bureau said we might could possibly have a structural deficit exceeding $1 billion. Are these incompatible, sir?
I don't know if they're incompatible. I think they're both looking at the future and where we can go and where we can be. And when you look at where the governor started and where we started when I came into the legislature 4 years ago with the governor, we had a true $3.6 billion structural deficit. We were able to clear that up and move forward. We have a surplus at this moment. Still waiting to see how the economy goes the last couple of months of this year, going into the next quarter, or the first quarter of next year. Mm-hmm. When you look at what the Fiscal Bureau put out, they're talking about if nothing's changed, spending-wise, revenue-wise, at the end of 17, yeah, we could have a $1.8 billion deficit. Well, constitutionally, we have to pass a budget before that happens. So I think there are some opportunities. I think the governor is bold in saying that we need to start reducing our taxes. We've done a great job these last 3.5 years, and we need to keep moving forward. Part of that, though, has to be the fiscal side. How are we spending our money? And I've talked about it in the last couple of weeks and talking with people. A lot of people would like to see what had happened if our departments went back to a base system. How much does it really cost you to run your operations for each department? Start looking at something like that might help us find out where we can really reduce some of the spending.
Okay, so you're not worried about a deficit, and you're more open to the governor's latest call for another income tax cut than worried about the deficit.
We have to be fiscally prudent. So yes, I'd love to see more tax cuts, but at the same time, I want to make sure that we're not increasing our debt. If we have a structural debt going through this next budget cycle, that's something that we have to look at. Bonding is still a big issue that we have. We still have, I believe, too much bonding that's going on. And it's something that we have to consider and move forward on. We've put ourselves in a good shape. You know, we've got the largest rainy day fund we've had in a decade plus. Something that we need to keep moving on and keep looking how we can be fiscally prudent.
Do you like the governor's plan for a tuition freeze both on the UW schools, and now, as of Sunday, he's proposing a freeze on the tech college side?
I think it's a great idea. Again, when I look at education, I look K-20 education, from kindergarten through college. You have to see that these kids are putting their time, energy, and effort, and these families are putting their effort into this. And in the last number of years, I'd say 15 plus years, we've just seen the cost of higher education escalate each year. We need to figure out why, and we need to put a hold on it. I think the freeze is a good start, but we really need to start looking at how are our two systems working together, and are there areas that they're overlapping that they shouldn't be, and how can we get them more fiscally prudent with what they're doing.
Two other things the governor proposed on Sunday, if he's reelected: a drug test for those who receive unemployment and food stamp benefits. Your response?
We've tried it before. We know that there is a hurdle that's there with the federal government. I think it's something, when you look at most businesses that I've been to, every single business that I've talked to has a drug testing requirement. They want to make sure that the people are there, they're working on time, and they're not high. They're not in a position that they could cause some harm at the company. If we're giving people those same benefits and helping them get out of a system, we should be able to make sure that they're doing the right thing, helping themselves get out of bad habits.
And then finally, he wants to cut from 60 months to 48 months the maximum period that someone could get both unemployment and food stamps.
Again, it'd be something I want to take a look at. I know the program came out on Sunday. I've always looked at what we should be doing in the government is kind of what Congressman Ryan has always said. We should be providing a safety net. We shouldn't be providing a hammock. give people the opportunity, give them a pathway that they can get out of that system and help to break what the cycle that they're in is a great idea. But we've got to make sure that there are certain people, there are individuals that aren't going to be coming out of that cycle. There are those with the higher needs and things like that that we have to make sure that we keep care of. That's what our charge is.
Let's go through some of the major items, assuming you're re-elected in the next budget. What's going to be your priorities when school aid to schools is up for debate?
You know what, that is a discussion. It's almost, as I kind of joke, the third rail in Wisconsin. When you look at school aid and you look at the formula, back in '93, the formula then was temporary. Well, 20-some years later, it's still kind of there. Mm-hmm. We've lost the 2/3 funding. We've lost the QEO. But the basis of it is still intact. And it's hampersome to some districts, and it's great for other districts. We need to look at how the formula is set up. We need to look at how we're funding our schools so that we're effectively and fairly funding across the board. I think that's one of the biggest things we look at, and there's changing dynamics that have occurred. When you look back in '93, we didn't have the charter schools as much as we do. We didn't have the voucher program like we do. There are other hamperness, there are issues that are out there that we have to fund, and we've got to take all that into consideration. I think it's time that we really start discussing a new formula.
You mentioned choice and vouchers. Mm-hmm. The Assembly Speaker would like the 1,000 cap on outstate slots removed. Do you support that?
Yes.
Okay.
When I look at it, again, the choice program was always designed for the parents to make what they felt was the best decision for their children. One of the biggest issues we found is safety. Their kids didn't feel safe at the schools that they were at. They got to these private schools, they got to the voucher schools, and they felt safer. They were able to just enjoy the learning atmosphere and progress. We're seeing that. Now, one of the big issues is, just like we have in the public schools, there are some poor voucher schools. We need to take care of them. We need to hold them accountable. But the successful schools that are out there, just like the successful schools we've got in public system, we need to exemplify what they're doing and try to duplicate what they're doing.
You were in the middle of the Common Core debate. This summer, Governor Walker called for Wisconsin to withdraw from the Common Core. I assume you agree with that. Do you want to come back to the bill that was debated, which would create a? Well, go ahead. Your position on Common Core, and the reason I say go ahead is because it's
it could go. It could go a long. Yeah, we could talk for an hour and a half just on that one topic.
Thank you for not going that long.
When you look at it, the governor came out and said we need to repeal the Common Core. I think what he was really saying was the second phrase. We need to create Wisconsin-based standards that hold our kids accountable to being college and career ready. And that's the key. The bill that we had last session, there were some issues and concerns that we heard about. There are some things that we're looking at to modify and adjust it. I think it's one of those that when we look across the board, one of the uniquenesses that we have in Wisconsin is the local control. 426 school districts have to adopt a Common Core. They can adjust things, they can work with them. The concern I have is the flexibility really there that the school districts perceive? Because part of our waiver for this whole problem or whole issue to get the Common Core was that they couldn't be adjusted by more than 15%. Something that we have to continue to look at. I think what we can do is we can come up with a set of Wisconsin standards that are effective, that are college career ready, that our higher education system says these kids, when they leave high school, they're going to be ready to step into the workforce, they're going to be ready to step into college.
Earlier you mentioned your objection to bonding. The Legislative Fiscal Bureau says $991 million was bonded for transportation programs in this biennial budget. Yet there's still projections in the next biennial budget of a shortfall, $600 million, $700 million. Well, if you don't like bonding, you don't want it to be made up that way. How can we fill that gap?
That's going to be a great discussion point. You know, and when you look at it, we look at the infrastructure and we look at especially transportation, Wisconsin. That is the main hub for moving our goods across and services across the area. You look at the zoo interchange right now, just at the beginning of about a 4-year project to get that done. It's amazing what they've already gotten through, but the costs are there.
$1.7 billion.
Yeah, when we look at how we pay for transportation, we have 2 vehicles. We've got the registration fee, and then we got the gas tax.
30.9 cents.
Yeah. So now that's it. We've got the referendum coming up in November that I believe a majority of the people are saying, yeah, we should keep that segregated. Transportation has to go to cover that. My concern is those 2 vehicles aren't enough. We've got to find some other alternatives. We've got to find some other ways to reduce that bond burden that we have. One of them might be looking at the sales tax that we have either on sales of cars or on the parts and services for the cars, and bring that in. There's got to be some ideas that we get out there and take a look at.
Okay. Health care. 1 in 5 Wisconsin residents get their health care from Medicaid. American Hospital Association says our Medicaid reimbursement rate's second lowest in the nation. You think we'll be able to afford to raise those in the next cycle?
We need to look at it. You know, when you look at, we're hitting the top 3 areas of our budget. When you look at education, Medicaid, and transportation, it's something that we've got to start looking at how we're going to prioritize. And you know, the Medicaid issues have been exacerbated by the Affordable Care Act and what's going on with that. But even before that happened, you heard from the hospitals, you heard from the associations who were saying that the reimbursement rate was low, that we've got to figure out how to get this better to make it more competitive so that we take care of those that are truly in need. And I think one of the ways of doing that is developing a new approach, and it's a more proactive approach. You know, you start looking at the wellness programs that are out there, getting people to understand healthy lifestyles are more important than just rushing into the emergency care if your child starts coughing, and what things you can look at. One of the neatest things that I've seen lately is how more and more companies are starting to work with the internet and virtual interactive systems, so they can get residents out in the rural areas, and even people that are in the urban areas that don't have the immediate access. They can call up a web doctor and say, hey, here's what's happening with my child. They can put a small little app on their phone, they can put a device on, they can get their temperature, they can get their blood pressure, they can see the basics, and see if do we go route A, hey, it's just a cold, here's what's going to happen, or is there something else we need, let's take it to the next step. Those are the things that we have to start looking at to be proactive, especially with our health care.
And was it, I think I know the answer, but let me ask it this way. Are you still comfortable with Wisconsin's decision to not take the federal money to expand MA, even though the Fiscal Bureau said it could have meant a $206 million upper in federal aid to help with the budget picture?
Yeah. And the reason I say that is we have got to stop at some point realizing that even the money the federal government is sending us shouldn't be sent back to us. It's not their money to be sending out. It's the people's money that they're using improperly. And we've got to stop that at some point in time. The federal government, with $17 trillion in debt, just keeps adding on. It'd be great to see a balanced budget system out there. I would love to see the federal government have to balance their budget on even a biannual basis like we do, to bring themselves into fiscal order. If we were to say, yeah, we'll take the money, who knows that in 2 or 3 years that the money's there, they could say, okay, we don't have that much, okay, the reimbursements are going to go down even more, and we're going to be back in that same situation.
The medical marijuana bill will be coming back next session. Now, Colorado and the state of Washington have legalized recreational marijuana. Your positions?
You know, we passed the CBD oil bill this past session. What we're finding out is there's still a hurdle with the federal government.
It's not been used.
No, it's still a Schedule I substance. Until they change that, now they have said we're going to kind of look the other way when the states impose these new bills.
24 or 26 states, medical marijuana.
But they still haven't given you a clarity of what they're trying to accomplish with it. One of the things that I have looked for is actual good solid data on how much of the THC has to be in there percentage-wise to be effective. You know, if we can start coming up with true percentages, is it 10%, is it 3%, that it's an effective threshold, I think we're in good shape. One of the concerns that I have, though, is when you start talking law enforcement and the medical world, they don't know what the lingering effects are. You know, I know typically somebody who's a drunk driving, they get behind the wheel, after X number of hours, the alcohol runs out of their system. They don't know what that threshold is yet with marijuana. And so we've got to look at those parameters as well. I know it's going to come up for discussion until the medical world signs off and says, yeah, we've got some strong data that says this is how good it is, this is what it can be used for, and we've got the law enforcement saying this is something we can control. I think that's what we need to look at.
It sounds like you're not interested in the recreational.
No.
Okay. Well, you mentioned it in your last answer. First offense drunken driving, should it be a crime?
I've talked to a lot of DAs. I've talked to a lot of people. And the first offense that we have right now as a civil offense gets on the record right away. There is a very low recidivism as they look at from that first offense going on. When we start looking at the multiple offenses, I think that's where we've got to start solidifying a better system. One of the things that we've got going on for us in Waukesha County is a drug and alcohol court. It gives the people an opportunity to get on the right path, clean themselves up. If they fall backwards, they come back in and they get the full slap of the law. But that's, I think, one of the things we have to look at is how much of this is a condition of a concern that we need to deal with moving forward. Instead of just criminalizing it, throwing them in jail, they get out in a couple of months and they're back on the road doing it again. We need to find how to solve that root problem of what's causing them to drink and get through that treatment.
And finally, do you want to highlight any differences between you and your opponent on November 4?
I'll just say that for me, I've been out, I've enjoyed the last 4 years working in the legislature, both in the Assembly and the Senate. And I've been out talking with my constituents, and I hope I'm doing a good job for them in representing them what their concerns are in Madison. I think we've got a lot of things going for us moving forward. There's been some good legislation that we've authored. The Uniform Trust Code, which is one of those bills that takes on a lot of information, but it gave the opportunity for markets in Wisconsin to become competitive again. And I think it's a great opportunity that we saw both private sector and the public sector come together to work very well. And that's what I look forward to doing next session.
Thank you. Senator Paul Farrow of Pewaukee is a Republican seeking re-election in the 33rd Senate District. Paul, thanks for talking to Wisconsin Eye.
Thank you.